Now with health and wellness question that a viewer is asking, it's about water pills. When's an appropriate time to take one, Doc?
Great question. Really common medication. One of the most common ones is called furosemide or Lasix. Many people know it well, especially if, for example, they're living with a diagnosis of heart failure. So water pills are meant to help as a diuretic. They'll help you excrete, urinate so that you can get rid of that excess water and decrease that swelling, which can, again, be due to things like heart failure, kidney disease, or even patients who just have swelling and it's been fully worked up and they can't figure out why. This is one of those medications that you want to choose, but you want to have a really open discussion about it, because aside from water, it can also help you excrete electrolytes, which can become harmful. So you have to be regularly monitored when you're on it. But again, it's very common, very popular, and I think it's really important to talk to your doctor about, especially when you get to the bottom of swelling and you want to look for other treatments.
Your prescription for wellness.
It's about prostate cancer. It's Mo-vember. As someone who can't grow a mustache.
No. Me neither, buddy.
All right, I'm in company.
Yeah.
All right, cool. I thought you were going to ask me about it, and I got nervous. I was like, going to have to tell you about how this is difficult. But Mo-vember month is a month where men are supposed to grow mustaches to raise awareness for things like testicular cancer, prostate cancer, and even men's mental health. So my prescription for wellness is on what to know about prostate cancer. It's really important. Number one, age is the biggest risk factor. The majority of those diagnoses happen at the age of 50. A diagnosis under the age of 40 is rare, but if you have a family history, it's important to talk about it. For example, if you have a father or a brother who's had a history of prostate cancer, that increases your risk by sometimes double. And then when to talk about screening. General recommendations recommend that we start as men talking about screening at the age of 50, but if you have an increased risk factor, for example, your age, your family history, or even as black men, we have a higher risk of prostate cancer, you want to have those discussions earlier.
Sorry,
no downside either.
I wasn't
No downside.
I wasn't laughing. I was just one of the members of our crew was twisting his mustache.
It's a great month, and you'll never forget it.
Yeah. Next medical viewer question: how do I grow a mustache?
And I'll be from Darien S.
You can hit us up on Instagram with all your medical questions at ABCGMA3.